Okay, Phil, I think we'll start. I'm sure there'll be a couple more people that will join us. We have about 20 people that are on the call right now or on the webinar. So, Phil, why don't you, if you would, kind of give an intro, and then I can take it from that. We are recording the webinar, so your colleagues that weren't available today can tap into it at a later time.
Okay, well, great. Thanks, Tom. This is Phil Lacey with Tryon. I'm our absence and health and productivity practice leader, and have been a member of IBI from almost its start. In fact, Tom and I go back many, many years, almost 21 years now, through various other employers that I've been with. And IBI has evolved over the years to be pretty much the preeminent organization in terms of data, research, and benchmarking. And so there's a lot of ways that we as members of MMA can utilize the tools and resources of IBI, and that's what we're here today to go through. I can tell you, in our practice at Tryon, our large life and disability practice, we're using these tools pretty much on a daily basis. When we do our stewardship reports for our clients, we embed the IBI benchmarking data pretty much in every single report we do. We have access to a number of research papers in here that date back many years, but there's a lot of good content here. In fact, I had a situation the other day where a client was asking me about different ways to attack their mental health issues, and so I was able to pull up about 2 or 3 research papers that had been done in the last couple of years on that topic and provide the client with some really useful information. So anyway, I think you're going to find this is really, really good stuff. And what Dr. Perry's going to do today is kind of take us through the tools and research and other things that are there for you to utilize and get you set up so you can access the IBI web as a member, and hopefully you'll be able to utilize a lot of the information here for your clients.
All right. Well, thank you, Phil, and thank you for everyone for joining us today. And as Phil said, my purpose today is to give you an overview of the resources that are available to you from IBI, given your membership level. MMA broadly, including Mercer, is what we call a stakeholder member. Phil sits on our board of directors. It's the top level of membership and gives you the most access to our work. So I want to take you through briefly an overview. Everyone on the call, all of your colleagues can get access to the very same things we're talking about today. So with that, let me give you just a quick snapshot of who we are for those of you who might not know us well. So IBI is a national not-for-profit organization. We have about 1,185 corporate sponsors, and our sponsors employ about 20 million people across the U.S. So it gives us a very broad reach. Over 1,000 of our members are employers, and the rest of our members, what we call our supplier members, are health plans, consultants, brokers, disability companies, wellness companies, pharmaceutical companies, the entire spectrum of organizations that work with employers around issues of health and absence and disability and productivity. So the theme that organizes our work really is broadly the question of what's the business value of workforce health? How do we take health and its related components like absence and disability out of the cost center and into the discussion of business strategy? So that's really what focuses our work. We focus a lot of our attention around measurement. We find that employers and our supplier partners really are focused on measurement and need some help in that area. We've built a variety of modeling tools. We'll talk about those today in additional to our benchmarking work. And we always try to bring it back to practical evidence. On the one hand, our staff has very good credentials as accomplished researchers. But on the other hand, we all know that if you can't bring research into practicality, it really doesn't do us much good. So that's the overview. I just want to give you a quick view of the website that you all have access to. If you aren't yet signed up with us, at the end of the webinar I'll give you my contact information, and we'll get you signed up. So this is the IBI website. As Phil mentioned, as you can see here, there are a number of things you can get access to. One of the keys is research and resources. So we provide a repository of information that you can access directly, and we've organized that around topics that our members have told us are really important to them, whether it's an employer member or a supplier member. So you can see here an example of how we've organized the research and resources part of our website around making the business case. And each of these broad categories has subcategories that you can see that you can click into and get access to our work. So making the business case, engaging employees, investing in health, managing absence, and understanding health risks. So in any of these, and let's take as an example the business value of health. If you click on that, it takes you to that section where we list what we have available, as you can see here. But it's also available in our search function. So you can search on a topic, and it'll bring up the things that we have available that are germane to that topic. So there's a wide variety of information that you can get access to very quickly on the topics that you're working on with clients. The second part is our tool section, and we'll talk most about that today. Our modeling tools, our benchmarking tools. And the third really is our educational area, our forum, and we'll talk about that as well to a certain extent. So the website is available to all of you at this level of detail. You can get access to things on a real-time basis that might be useful to you as you're working with your clients. So let me start with research. I won't go into great depth, but I want to give you a flavor of the kinds of areas that we're doing work on, and this is all accessible from the website that I just showed you. One of the things that I personally believe is going to become a bigger and bigger part of strategy around healthcare for employers is the fundamental question of how does health and lost work time impact performance of business. And we are actually engaged in the front end of a major research project on this topic. Well, we're going to bring in health-related data, absence data, and connect it in working with several major employers to actual business performance metrics. And the reason for this is we need to start talking about this not just as a bottom line cost, and that's where the focus of the conversation has mostly been, even when you talk about broad health and productivity costs. And into the conversation is how does health drive the top line? How does health drive performance of our business? Because if we can establish that body of evidence, that helps us change the conversation with our clients around why health and managing absence and disability is important and the impact it has on the company. Been a lot of conversation about paid parental leave these days. We're just finishing a project in the high-tech industry, a series of case studies around that issue. Return to work is something that is a big part of the work that we do. We're about to publish new research on the impact of return to work programs, which actually has linked claims data with the policies of individual employers. It's a unique research project, I think the first of its kind on this scale. We're also examining the impact of culture of health and well-being on productivity. I think we all know that the very nature of how employers are talking about health and wellness has changed. It's expanded into the topic of well-being and the issues of what affects well-being, corporate culture being one of the key factors, is really in the minds of employers, and we're doing research on that right now, looking at what the research literature tells us about the impact of health and well-being on productivity. Again, the value of treatment on work disability, and the final thing we're working on is helping employers kind of build a roadmap to better manage health and productivity. Employers tell us all the time that all this research is great and we really think it's important that IBI is the leading research organization, but give us practical steps that we can take to get us from where we are to where we need to be in managing a healthy and productive workforce. So that's another one of our research projects right now. So I just wanted to give you a flavor of the kinds of areas that we're working on right now from the research standpoint at IBI. Now let's turn to that other area of tools. And we found out long ago that if you go to an employer, and you probably all had this experience, if you go to an employer and essentially say, if you give us lots of data, we can really tell you important things about what's going on in your organization. And actually, 15 years ago, as we started working in these areas with employers, we started to do that. And we found over and over again employers saying, you know, I don't know what data we have. I don't know how to access it. I don't have time for that. I've got smaller staff than I used to have, so I just can't go there. And what we realized is that there's an important step that we could help employers take, which is when you don't have the data, can we take some characteristics about your company and model for you, using statistical models, what this all might look like for your organization. So what we've done is we've really focused the development of tools in two broad areas. One, the impact of absence through our absence cost estimator and our benchmarking, and I'll talk about each one of those. And then on this broader question about the fundamental economic impact of health, we have built models that actually can help an employer estimate the total economic impact of health and what kinds of conditions are the key drivers for health and productivity. So let's first look at absence. And I think one of the things we find often is, it gets back to that fundamental question, is most employers cannot tell you how many days of lost work time exist in their workforce. Yet that's becoming a fundamental part of the conversation around health, because if my employees aren't at work, that means they're not doing the things I hired them to do. So we built a modeling tool we call the absence cost estimator. And let me actually show you real quickly how it works. This is an online tool. It's available to everyone on the call today. So I'm going back to our website in the Tool tab. We'll go down here and click on the absence cost estimator. And now we'll click right here on Generate a Report. So this will show you how simple it is. And essentially what this does is it says if we can get a couple of key pieces of information from the employer, pieces of information that do not require the employer a lot of time to dig around and find, then we can start to put that employer in the ballpark around what absence means to their company. So let's just show you how this model works. And you see here the first thing we want to know is the industry, defined by NAICS code. So let's take manufacturing as an industry group, a two-digit level, two-digit NAICS level. Now,
hey, come here, I'm on a call.
As you can see here, there are other more detailed levels within the manufacturing sector we can add in. So if you knew the 3 or 4-digit NAICS code for that client, you could actually enter that and the estimates get better. But let's just start broadly. Let's start with the idea that you really only know a couple of key things about your client. You know that they're a manufacturer. You know that they have 5,000 employees. And maybe you know for this company, and you can see that the model is loading the data, maybe you know that 15% of that, 85% of the workforce is full-time. And additionally, that you know that 15% of the workforce are females. And that's all you know. Now, if you know more detail, like as you can see here, the age distribution, you can enter that. But even if you don't know that, the model will use industry default values to run the model. Now, what we also give in the report, as you'll see in a minute, are targets for reduction. If we improved absence by 1%, 2%, 5%, and 10%. How does that translate? But maybe you have different targets you want to focus on. This actually allows you to add targets yourself. So maybe you want to know, well, if I saved 20%, what would that look like? So you can actually enter your own target numbers as well. So this is all we know. 5,000 life manufacturer, 85% full-time workers, 15% females. And the question is, what does absence mean to this company? So we click on Calculate. The first thing you see in what pops up on your screen is the profile of that employer. Now, as you remember, we entered 3 pieces of information. Their manufacturer, 5,000 lives, 85% full-time workers, 15% females. The model itself will now essentially generate from industry statistics what we would expect in the age distribution for that employer. So even if you don't know that, the model actually uses industry default values. And then it does the same thing for occupations. So we have a lot of detail we use in the model to actually tell us what absence looks like. And here is the report you get. So you see very quickly that absence is responsible for about $8.5 million in costs, and that's divided between wage replacement payments, because most employers do in fact pay their employees when they're absent from work, and about $2.8 million in lost productivity around absent employees. The model also tells us what percent of that lost work time is related to health, in this case about 87%, and it gives us information on the total lost work days we would expect, about 31,000, and lost work days per FTE, 6.7 per person. And then we get down to the savings estimate, as I said, 1, 2, 5, and 10%, dollar savings, and workday savings. So this is a way for you to, in a conversation with a client, talk about absence in the absence of information. When you have no information about the client going in, it's a way to say, we're tapped into this independent, not-for-profit research organization who does this kind of stuff for a living, and we can start to get you in the ballpark about what absence might mean. And then based on the numbers, you can decide whether that's important enough to want to talk about or want to take steps to actually get your own information. You can actually export the report as PDF, share it with your client. So it's a way in the very first part of the absence conversation to engage that client in a conversation with you about absence. Any questions at this point? Phil, you've used, I think, the absence model. Maybe
I have.
Insights into the kinds of conversations you have with clients around that basic kind of data.
Well, I think the big one is that so many of our clients still to this day manage their programs in silos. So when they evaluate, healthcare issues, they're only looking at their healthcare data, and they're looking at that in a silo. They look at their absence and disability data in silos, and they don't really make the connection that, hey, people out on disability are a huge part of your medical cost spend. So it helps to drive that point home, and it gets you to have a broader conversation with your clients on what other kinds of things you could do, or if we could get actual data from you, what would be some of the things that we could evaluate to actually pinpoint what's driving your costs.
Great. Okay, let's move on to the second part of the absence conversation, which is benchmarking. And this is really our longest standing program. And it really came out of the questions we would get from employers about, well, I need to know how I compare to my industry peers. If I'm doing well, maybe I don't have to pay a lot of attention to that program, but if I'm not, maybe I do. And in order to answer that question, they really wanted benchmarking information. So starting in the late 90s, we started building our benchmarking program, which now is the largest database of both occupational and non-occupational programs in one place. We were able to build this database because we get data from these companies that manage lost time programs. So we get data at the claims level essentially pretty much for the book of business of all these companies. And that has allowed us to build these very, very large databases that provides benchmarking information for employers. The focus on the non-OX side, incidents, lost time, duration, and claims costs. For disability, STD and LTD, we also have plan design information in the database and report by that. And we have diagnosis codes. In workers' comp, and for the past about a year and a half, we've gone through a major revision in our workers' comp benchmarking. So the workers' comp focus is claim mix, duration, cost, and diagnosis, and we get 60 months of loss development data at 6-month intervals. So we have the ability to look at trending and loss development from workers' comp standpoint, which, of course, if you work in the area of workers' comp, you know that kind of information is really important to help your clients understand what's going on. So we're just finishing our 2015 claims experience database. As you can see here, we have data in the database on more than 52,000 employers. That gives us the ability to actually provide benchmarks for over 1,000 SIC codes. And this is all based on about 5.2 million claims. So this is by far and away the largest database of this kind that provides benchmarks for employers by industry. Now let me show you from that program what's available to you directly through the website. So we'll go back into the website. This has brought us to the tools section and benchmarking, the benchmarking group in the tools section. And as you can see here, you'll see quickly it's really kind of a point-and-click way to get benchmarking reports. The first thing we want to know is the year. So right now we have 3 years of data. So you can actually get benchmarks on 3 years. As I said, we're building the 2015 database right now. And you see here 2 different features that are available to you. Now, this is not available to all of our members. Because you folks are at our stakeholder level, you get the most access to this kind of information. So let's start with the fundamental of industry summaries. That is, you're working with a client, maybe it's a manufacturer or any other industry segment, and they say, I want to know what benchmarks are for my industry. So we click on industry summaries. You select the program you're interested in. Let's use short-term disability as an example. And then you select an area of interest. And what that is simply a description of industry at the highest level in order to kind of organize getting access to all that detail. Instead of listing every single SIC code, all 1,000 of them in one place, we kind of built this hierarchically to make it easier for you to use. So you know that your client's in the manufacturing industry, and now we simply hit proceed. And what now the program tells us is we have a lot of detail about manufacturers. So as you can see here, we have detail at the 2-digit SIC code, 3-digit, and oftentimes 4 digits. So within the manufacturing sector, we have a lot of detail about subunits within manufacturing. So maybe you're talking to a client, a manufacturer, and they might want to know, well, for manufacturers generally, what do benchmarks look like? But they also say, but I'm in this segment of the manufacturing industry, so tell me what's closer to my segment. And you can actually go through what we have here and select the SIC code that most approximates your client. So for purposes of illustration, let's just click on all manufacturers, and then we download the report. As you can see here, it pops up right here. And now you have, in the space of a few seconds, a report on benchmarks for short-term disability for all manufacturers. And let me just take you through very quickly what's in it. And you can see here we've organized these reports by the basic questions that employers have about their program. So, for example, you'll see, well, how often is a program used by my employees? And we have a set of metrics that address that question: new claims per 100 lives, new claims per covered life, excluding pregnancy, etc. So we have different avenues or different metrics which help us address that broad question. And for each of those metrics, we have two key features, two key statistics. One is the group average, which is the arithmetic mean, and then also the group median, which is the 50th percentile. Now, why do we have both of those statistics shown side by side? Well, we're often used to describing, and I'll talk in kind of statistical terms now, we're often used to describing distributions using the average. Everybody knows what an average is. But what people often don't know is the average value is very influenced by either very large values in that distribution or very small values. And if you have a relatively small number of large values, it can really pull up that average. The median value, the 50th percentile, is the midpoint. It is not influenced by either very large values or very small values. So we want the user to be able to select the statistic that makes the most sense to them from the standpoint of talking about this. I think as a rule of thumb, if you see big differences between the average and the median, I tend to like to use the median value because it's not influenced by the outliers. But it allows our users to decide how to talk about these to their clients. We also give more detail on the distribution, the 10th percentile, the 25th percentile, 75th, and 90th. Now that gets a little more complicated sometimes, except when we think back to taking the SAT test in high school. If you're at the 90th percentile, that kind of means something. That means only 10% of the people have values higher than yours. So this gives you a sense of the shape of the distribution, again, as a way to talk to a client about how they might fit in what's going on in their industry. We also show for each of those the number of claims and the number of employers that go into that calculation. That matters a lot because oftentimes when you see statistics, you don't know if it's 3 employers that it was calculated on or 5,003 employers. So by knowing the number of employers and number of claims, this gives you more confidence in the validity of that calculation. So we organize the reports around that same structure based on the questions: how severe are the cases, how much lost work time, and then around return to work. As I mentioned, we also have plan design information in our STD and LTD reports. And what we essentially do is, as you can see here, we built a typology, plan A, plan type B, C, etc., based on the elimination period and the maximum duration of benefits. So it gives you one more area to discuss with your clients about, well, what kinds of plan designs are typical in your industry, and what kinds of results do we see with those kinds of plan designs. And then finally, in the reports, is information by diagnosis code. So the other part of the conversation with employers is, well, what are the diagnoses that are driving my lost time? Because I want to, as an employer, start thinking about what kinds of disease management programs and wellness programs I have in place and how they might influence my lost time programs. So it's a very simple point-and-click way to get information that you can use with clients. Any questions at this point? Okay. Good. Now, let's go to the next part, which is using benchmarking reports. And oftentimes, and I think the greatest use of our benchmarking reports is around helping a client see how they might compare within their industry. But I think one of the uses that is not so often utilized by our members is when initially talking to a client or prospect, mostly a prospect, about what's going on in your industry. So often from what we hear, someone goes in to talk to a client, and they immediately start talking about the services and products they have available to sell to that client. And every employer has experienced that. But by using benchmarking information, you can walk into a client and say, let me tell you about your industry. Let me tell you what's going on in your industry by way of plan design, by way of benchmarks, by way of typical diagnosis codes. So it really allows you to kind of be an industry expert walking in the door, either through benchmarking reports or actually by running the absence cost estimator, and change the conversation with clients. And I think that's an area of utilization that is really an opportunity in working with clients starting off.
Hey, Tom, it's Phil. Let me throw an example in there because I think that you hit on a really good point. We'll walk into, for example, a hospital, and they'll say, well, we've looked at our incidence, and our incidence of STD is actually really good. It's very low, or our incidence of FMLA is only 14%. And we'll walk in with the IBI benchmark and say, well, actually, in your industry, it's a lot higher than that. We suspect that if we were able to do focus group interviews or whatever, we might understand if that is a good number or not. And then we'll find out that their employees are really not reporting those leaves to the vendor that they're currently using. So it's going into timekeeping, but it's not actually being reported to the people that need to manage that leave. So all of a sudden the client's going, well, we didn't realize that was going on. So when you have these benchmarks and you can walk into a meeting with a client, it immediately gives you the ability to have a discussion on something that might be very relevant to them.
That's great. That's a good example, Phil. Thanks. Now, the other part of our work starts kind of with the front end. And, of course, there is so much discussion about healthcare these days. But I think one of the real fundamental points, and one of the points that I make when I speak to our employer members, is you need to change the conversation about health and health investment if you want to be germane to your organization. Because there are many ways your company can deal with health care now, including walking away and paying the fines, which by definition are less than health care premium. So how do we start to change the conversation about health from a value standpoint? And that's what we've done here at IBI with one of our other tools, which is let's start with this conversation. If we're going to manage health, we better have a better sense of the total economic impact of health on my company. A lot of employers have focused only on healthcare costs and have equated that to the economic impact of health. But, of course, we all know that when you add things in like absence and disability and productivity, that changes dramatically. And it gets back to that fundamental point. If we think it's tough to get data just around absence, imagine how tough it is to get data on everything. So the full cost estimator model actually allows us to model for an employer what this looks like economically for their company. And the model impacts you'll see, and the model inputs you'll see are very similar to what you saw in the absence cost estimator. We want to know the industry, the number of employees, percent full-time workers, and again, demographics and benefit enrollment percent. So these are the model inputs. And actually, again, just like the absence cost estimator, we can run this model just by knowing the first two, industry and number of employees. And the model will actually use industry default values to fill in all the blanks. Now, on the outcome side, the report content side, we have in the report the estimated number of sick days, short-term disability days and costs, LTD, workers' comp, FML, performance, presenteeism, which is a measure of lost productivity, and group health. Now, what we typically do is we start the conversation around group health costs because every employer knows how much their group health program costs. And then the question is, well, how big is this other stuff relative to group health? And if it's big enough, do you need to pay attention to it? And we find in these modeling exercises that typically group health, both medical and pharmacy, represents only about half of the total economic impact of health. And these other outcomes, absence, disability, productivity, represent the other half. So just a couple of examples of the report itself, some graphic examples of these dimensions and how big they are relative to one another in a pie chart as well as a bar chart format. In this case, the medical and RX, 47% of the full cost of health for this employer. And this is 1,000 employees in the hospital industry as an example. And then the other part is kind of a tabular part showing the wage replacements and lost productivity by program area. So they're very good ways to essentially reframe the discussion about health for an employer in a far more strategic way than just around plan design and healthcare costs. And I think what we're seeing in the marketplace is this pressure on employers to go to full replacement consumer-driven health plans in order to save medical dollars without thinking about, well, will my employees still adhere to their treatment plans, their drug regimens? And if they don't, what are the implications for these other impacts? So it's a way to start talking about strategy, health and productivity strategy with an employer, using data to do it that doesn't require the employer to spend a whole lot of time and a whole lot of money going out and getting their own data. So again, we built these modeling tools as a way to help change the conversation with an employer without dealing with the real constraints. As part of the full cost estimator, we get down into actually individual conditions. Part of this in the full cost estimator relies on 5 very large databases. The model essentially taps into 5 very large databases. One of those databases has come to us through a partnership with Ron Kessler at Harvard Medical School and the work that he has done with employers and employees around chronic conditions. Not only the type of chronic conditions, how often employees are getting care for those conditions, comorbidity and productivity loss around absence and performance. So when we start to add this piece in, we start to see the distribution in a number of chronic conditions. Now, because this part of the model does not rely on claims data, we start to see often more chronic conditions popping up because Dr. Kessler's tool asks employees what conditions they have, not what conditions are you being treated for. That is, what conditions have a doctor diagnosed. And of course, we find that there are many conditions that employees have that they're not getting care for. So by only looking at medical and pharmacy claims data, you're not getting a window into health. You're only getting a window into treatment. So for example, in this case, only about 29% of the conditions that employees say they have are actually being treated in the medical system currently. And it's a great way to help an employer understand that under treatment may look good if you only care about medical and pharmacy claims costs, but undertreated people miss more work, they don't perform at work, and have more lost productivity. So again, it supports that conversation. And then finally, the conditions that are the big drivers of lost productivity. And this is very consistent with research we published, probably 4 or 5 years ago, worked with 10 large employers, brought together all their medical and pharmacy claims data and data from the Kessler self-reporting tool. And what, of course, is interesting is you see often, this is a very typical case, where depression is the biggest driver of lost productivity. So this, again, allows the employer to consider their strategy in health, disease management, EAP, and their strategy around what they're going to measure to know what's important to them. Now this tool, the full cost estimator, is not an online tool, although we are in the process of building it into an online tool. So if this is something that you wanted to run with a client, you'd get in touch with us and we would actually work with you and the client to run it and then go through the results with you and the client by phone. So that what we have found, of course, is that nobody wants to talk to a client about something they don't fully understand. This is a pretty complex model covering all the dimensions, and so we participate in those conversations to help move that along. And then finally, in the other area in which IBI works, education communications, we have a national conference in San Francisco in March, bring together typically between 460 and 500 people around these issues. It's a little different in that it's not a conference that's driven by marketing. We have no exhibit hall, for example. It's a conference driven by content, research, case studies, and networking. It's a very successful event. Last year we had more employer organizations at the conference than we did vendor organizations, and to us that's a very good thing. We also do regional programs. We're partnering with 3 of our employer members to do half-day programs at their sites, and we invite all our employer members in the geographic region, and we invite our supplier members as long as they bring an employer with them to these meetings, so that a majority of people in the room are employers. Everybody likes that. So this year we're working with Amazon. We actually had a program with Amazon in June around their leave management strategies. We're working with Comcast for a program in Philadelphia in September around the use of technology in managing health and productivity, and we're doing one with Target in Minneapolis in October and focusing on resilience. So we find that by working together with employers and drawing employers to these meetings, it's a great way to connect, to talk about topics of interest to everyone. We do webinars when we publish new research for our members and guests. We also do webinars and seminars in partnership with our high-level members, like you folks. Done a lot of those. A new feature is what we call Market Perspectives, which actually allows our members to post their content on our website that is based on research, case studies, or white papers. It's not a place to put a marketing brochure. It's a place to really demonstrate the work you're doing in an area and how you're thinking about that particular topic for employers. All of our supplier members, like you folks, can essentially give access to any employer that you're working with at no cost. So any employer you can essentially set up with us to get access to our work at no cost to the employer. We did this because we wanted to put no financial barriers between IBI's work and employers. Employers are the market that we want to help influence, and we want to give them access, and you can facilitate that by essentially making them an employer member of IBI at no cost. And as I said earlier, all of your colleagues can have the access to our work that I've talked about today. And so, as I said, we're recording this webinar, and we want to make sure that you folks have access. And if you aren't getting access, if you're not signed up for access to our work, you can email me. There's my email address right there on the screen. And then we can get you set up and move things forward to give you the access that we've talked about today. So that's kind of a high-level overview of IBI and our work. You know, we are, on the one hand, a membership organization, but on the other hand, we really see ourselves as a strategic partner with our members in moving down this path to a much broader and bigger view of health and outcomes. So, Phil, if you want to add anything, or I can certainly answer any questions that anyone might have about how to get access and work with us.
Yeah. So for all of you from MMA, if you have large clients that you feel would be something, they've got an issue or they've got data that would be made for a good research project, we can enlist Tom and his staff to actually help us do that if we have the right kind of data and we have the right kind of project to go about. So think about that. We can also think about maybe doing something collectively around having an MMA-wide webinar so that IBI can maybe go through some of the recent research that they come out with on a periodic basis. So we can make that available to our clients and sponsor that webinar, and then have Tom do some presentation on research that's recently been released. So there's other ways that we can utilize IBI to our advantage, and since we are such a kind of a disparate group compared to a lot of the other members out there, I think we've got some opportunities with our size to be able to leverage them to assist with a lot of things that we can do for our clients. So use me if you need to as our kind of our board representative. If you have ideas of things that you think we could do, use me, and I'd be happy to work with Tom and his staff to see what could be done.
Right. And one of the things I should mention. I'm sorry. Go ahead.
No, I'm sorry, Phil. This is Sally. I was just going to say I think that's a great idea, Phil, and I appreciate Tom's overview today, and I'd love to work with you both to make that national webinar happen.
Sure.
And certainly I think it's a great way to showcase our stakeholder relationship.
Great. Thank you, Sal. One of the things we hear a lot about, a lot of questions is, well, how do CFOs see this issue of health? And are CFOs thinking more narrowly about it, more broadly, post-ACA? So over the years, over the last decade, we've published 4 major studies with CFOs. And our last study we published a few months ago, a survey of about 350 CFOs. It's available on our website, and it really tells us a lot about how CFOs are viewing health. And I think the most important thing, it tells us how broadly CFOs are seeing this issue of health. It's not just about medical costs. And in fact, in the survey, we asked CFOs, tell us the 3 most important goals, 1, 2, and 3, that you're trying to achieve through your health programs. Fewer than half these CFOs said controlling medical costs is our most important goal. That's really critical to people that manage benefits in trying to figure out how do I approach senior management in this conversation about health. So that research is available on our website. You can share that. It's a great way, again, to be a key asset to your clients around what is going to be a bigger and bigger part of their jobs, which is making their own business case for health inside their company. So I wanted to point that out as well. Any other questions that I can address today? I'd be happy to do that.
So, Tom, for people to get access to the website, they basically need a password, an ID, and a password, and how do they go about getting that?
Well, tell you what we can do. Just you can shoot me an email. I'll pass that along to my assistant, and what she'll do is she'll send you an email with your user ID and password.
Yeah, and just for the MMA folks on the call, Tom, I think that we have initiated that process for most of the individuals who joined the call today through your assistant. So Kim Sandick, who works with me at the national level, also has established that touch point with your organization. So obviously Tom's been generous enough. If you don't have that yet, you can reach out to Tom. And also Kim Sandick is available inside the organization if anybody gets stuck or needs help.
Great. Thank you. So I just want to emphasize we're here as a resource to help you. We're not an organization that wants to take your money because we like to do research. We want to take your money because we think there's a good business reason for us to work together. And so see IBI as a resource. When things come up, when you're working with clients, it's easy to tap into us and share with your client. Here's the latest thinking on this, or here's benchmarks, or here's a way to think about health. That's what we want to do with our members to support this conversation, to really help employers move to the broader view of health, what it means to their companies, and stay in this and invest in it. Okay. Well, thanks very much, Sally. Thank you for helping organize this. Phil, thanks for adding your insights. As a long-standing IBI member, as Phil said, Phil and I go back to the very earliest days of IBI about 20 years ago. So I appreciate the opportunity to tell you a little bit about our work, and we certainly will look forward to working with you as we go forward.
Great. Thank you so much, Tom. Thanks, Phil.
Thank you. Take care. Have a good weekend all.